Hello and welcome to the Emergency Room Podcast, the place where we delve into the fast-paced, life-saving world of emergency medicine. Are you ready to explore the critical decisions and cutting-edge treatments that happen daily in the ER?
Welcome to a deep dive into the 2024 ILCR guidelines, specifically for basic life support.
Yeah, focusing on BLS.
We know you guys are getting ready for your EM rotations.
Right.
So we're going to focus on the stuff that you really got to know.
Yeah, absolutely. The most critical skills and knowledge to excel in your rotations.
So let's jump right in with the BLS chain of survival.
Okay, sounds good.
You're already familiar with this concept,
Yeah.
but these updated guidelines have some pretty interesting changes.
They do.
So one of the things that I thought was really interesting
Okay.
was the optimal surface for CPR.
Okay.
So traditionally, we've all been taught to put the patient on a backboard.
Right.
And that may not be the best thing anymore.
Yeah, that's right.
So what is the thinking behind that?
Well, you need a solid,
Right.
firm surface to provide effective compressions,
Okay.
to really generate enough force to circulate blood effectively.
Okay.
And while backboards are firm, they have some give.
Okay.
And studies have shown that using mannequins, that hospital mattresses or even just a firm mattress you'd find in a home
Oh, wow.
are actually a more stable platform
Interesting.
for allowing good depth and force with each compression.
So are they saying to not even bother with the backboard?
Pretty much, if
Yeah.
you can get them on a floor or
Right.
a mattress or a firm surface like
Yeah.
that, that's going to be better.
Wow, that's fascinating.
Yeah.
I wonder how that's going to impact like
I know.
EMS and
Yeah, it's a great question and one that I think researchers are trying to answer because the science is constantly evolving and we need to stay informed about the best way to provide patient care.
For sure.
Yeah.
Okay, so we've got the patient on a firm surface.
All right.
Let's talk about activating emergency services.
Okay.
So it all starts with a call to 911.
Right.
And one of the challenges that dispatchers face is
Absolutely.
recognizing a true cardiac arrest over the phone.
It's very difficult. It's got to be so hard.
Yeah.
Because they're just listening to the caller who's probably panicked.
Right.
And they have to determine if the person's breathing normally,
Yeah.
which
Well,
I can only imagine.
And one of the biggest obstacles they run into is agonal breathing,
Right.
which
Which can sound like normal breathing.
it can.
Yeah.
Yeah, it can sound like normal breathing to someone who's not a medical professional.
Totally.
So it could really delay
Right.
getting help to the scene.
So what are some of the strategies
Sure.
to help dispatchers be able to recognize this better?
So one approach is to actually bypass the breathing question altogether.
Okay.
So instead of asking if the patient's breathing, they might ask the caller to put their hand on the patient's stomach
Okay.
and feel for any movement.
So instead of listening for breath sounds,
Exactly.
they're feeling.
Yeah.
Got it.
But it's important to note that no single method has been proven to be superior.
Of course. As always, more research is needed.
That's right. Okay, so let's say that the dispatcher recognizes a potential cardiac arrest.
Yeah.
What's the next step?
So the next step is dispatcher-assisted CPR,
Okay.
which is a really important link in the chain of survival.
Right.
So dispatchers are trained to guide callers through the steps of CPR
Right.
while they're waiting for EMS to arrive.
Okay.
So that immediate intervention can buy precious time
Right.
and significantly improve the chances of survival.
So how do we make sure that those instructions are
Yeah.
clear and effective?
That's a great question.
Because it's such a
Yes.
crazy situation to
Right,
get hit.
absolutely. And researchers are trying to
Yeah.
explore different approaches to this.
Okay.
One of the things they're looking at is simplifying the language.
Okay.
So moving away from medical jargon
Right.
and using more action-oriented phrases
Got it.
that are easier for laypersons to understand.
So keeping it nice and simple.
Yeah.
Yeah. Okay. What else?
Another thing they're looking at is the potential of video instructions
Oh,
compared to just audio-only guidance.
okay.
So the thought is that visuals might help callers better understand the correct CPR technique,
Right.
and that would lead to more effective compressions.
So it's like they can see what
Exactly.
they're supposed to be doing.
Exactly.
Yeah.
Yeah, that makes a lot of sense.
But again, we need more research
Of course.
to confirm that this is actually effective
Right.
in real-world scenarios,
So especially with
pediatric patients.
patients where it's a little bit different.
Exactly.
So we have early recognition,
Okay.
we have EMS activation,
Okay.
and then we have dispatcher-assisted CPR.
Right.
What else?
So then the next critical link is rapid defibrillation,
Okay.
if needed.
Right.
And that brings us to AEDs.
Okay.
The automated external defibrillators.
Okay.
And these are becoming increasingly commonplace in public spaces, which is fantastic.
That's great. Right. Even if someone's willing and able to help, they might not know where to find an AED.
Absolutely. And getting that AED as quickly as possible is so important.
Exactly. So this is another place where the dispatcher can play a really important role.
Okay.
They can guide the bystander to the nearest registered AED.
Okay.
Minimizing that delay in retrieval.
So the dispatcher is like the conductor of this whole pre-hospital
He's the conductor
response.
Yeah.
That's pretty cool.
Yeah, it is.
But are there downsides to having dispatchers
That's a good
try to guide the bystanders through AED use?
There are potential risks.
Because they're already trying to do CPR.
Right.
It's a lot to ask of somebody.
Yeah. So, for instance, a lone rescuer might struggle to balance AED retrieval with ongoing CPR.
Right.
Or some bystanders might just find the instructions confusing.
Sure, especially under pressure.
Exactly.
Right.
So we need clear and concise instructions from the dispatcher.
Yes.
But we also need AEDs that are user-friendly and easy to operate.
Even in a chaotic,
crazy situation.
Absolutely. Yeah. Okay, so let's talk about what you do once you get on the scene as the medical professional.
Okay.
So the first step, according to the guidelines, is to check for responsiveness.
Okay.
So you want to tap the person gently and ask loudly, "Are you okay?"
Right.
Just to establish whether they need immediate medical attention.
Got it. So if there's no response.
If there's no response, then you need to shout for help.
Okay.
You need to have someone activate the emergency response system.
Right. So get someone on the phone with the 911.
Exactly.
Yeah.
While you begin CPR.
Okay. So while they're doing that,
You're going to quickly assess the situation.
Okay.
Check for breathing and a pulse.
Got it.
Look for chest movement. Listen for breath sounds, and feel for a carotid pulse.
Okay, so checking for those classic signs of life.
So if they're not breathing and they have no pulse?
If they're not breathing or they have no pulse or you're uncertain at all, then you're going to start CPR immediately. Okay. And this is where those high-quality compressions are really important.
Remind me again about those high-quality compressions.
So you want to position yourself directly over the person's chest.
Okay.
Interlock your hands.
Okay.
And push hard and fast in the center of the chest.
Got it.
Aiming for a depth of at least 2 inches with each compression.
Okay. At least 2 inches.
Yeah, at least 2 inches, and then allow complete chest recoil before the next compression.
Right. And then minimal interruptions as well.
Yeah, minimal interruptions, yeah.
Now, you mentioned the 30 compressions to 2 breaths.
Right.
Are there ever times when we would change that?
So you're referring to hands-only CPR?
Yeah.
And for adult victims of witnessed sudden collapse, where you strongly suspect cardiac arrest, hands-only CPR is a valid approach, especially for bystanders who may not be comfortable with rescue breaths.
Right, because getting those compressions going is the most important thing.
Getting those chest compressions started as quickly as possible is the priority.
Got it. But we're trained in compressions and breaths.
You are correct.
Okay.
You are correct.
However,
the focus on hands-only CPR for laypersons is really to encourage them to take action without hesitation.
Makes sense.
But for us, providing both compressions and breaths remains the gold standard.
Okay, that makes sense.
Yeah.
So let's say we've started CPR and an AED arrives.
Okay.
What are our next steps?
As soon as that AED is available, you want to put it to use.
Okay.
So power it on.
Okay.
Follow the voice prompts.
Okay.
And attach the pads to the patient's bare chest.
Got it.
The AED will analyze the heart rhythm.
Okay.
And determine if a shock is advised.
So it's doing the thinking for us.
It's doing the thinking for you.
What happens if it advises a shock?
So if it advises a shock, you want to make sure everyone's clear of the patient.
Okay.
And then you're going to press the shock button.
Okay.
Immediately resume CPR, starting with chest compressions.
Got it.
And continue following the AED prompts.
So just keep going with whatever it's telling us.
Exactly.
It'll help arise.
Exactly. You're working with the AED as your partner.
Got it.
It's pretty remarkable.
Yeah. It really
and how far technology has come.
Now, speaking of technology, you mentioned the ultra-portable or pocket AEDs.
Right.
What do the guidelines say about these?
So the guidelines acknowledge that these ultra-portable AEDs hold immense potential, especially for increasing AED availability in a variety of settings.
Makes sense.
However, they also highlight that we need more research to determine their effectiveness.
So what are some of the questions?
Yeah, what are we looking at?
That they're trying to answer with that?
So we need more evidence on how accurately they analyze rhythms compared to the standard AEDs. We also need more data on their effectiveness in delivering shocks and actually restoring a normal heart rhythm.
Yeah, do they really work?
Yeah, do they really work? And then also just logistically, how do we ensure they're properly maintained and ready to use when needed?
Yeah, so they need to be accessible, charged, and functional?
Right.
So it's just like...
It's like anything else.
Another thing to think about.
Yeah, it's another thing to think about.
But I mean,
they have the potential to be game changers.
Yeah.
But as with any new technology, we need to proceed with caution and gather that evidence before we really widely adopt them.
Yeah. Okay, so we've talked about the technology now. Let's talk about feedback.
Okay.
And how important it is to refine our skills.
Right.
So what do the new guidelines have to say about feedback?
So the guidelines specifically address the use of feedback devices during CPR.
Okay.
And these tools provide real-time information on your compression rate, your depth recoil hand position.
Got it.
So they really guide you towards that optimal technique.
It's like having a little...
Yeah, like a little coach.
CPR coach.
Right there with you.
Yeah, but how effective are they?
So the ILCOR consensus is that these real-time audio-visual feedback devices can be beneficial.
Okay.
Especially when they're integrated into a comprehensive quality improvement program.
So it's not just about having the device, it's about...
It's about using it strategically.
Right.
Within a structured approach to CPR training and performance evaluation.
And it sounds like it's not just for healthcare providers.
It's becoming increasingly important for training lay rescuers as well.
Oh, wow.
Yeah.
So what are we learning about how to optimize feedback for them?
So one of the crucial findings is that feedback needs to be clear, concise,
got it,
and avoid medical jargon.
Okay. So dumb it down.
Dumb it down.
Yeah.
And it should focus on those specific actionable instructions that are easy for them to understand and apply.
So make it relevant to them.
Exactly. Okay. Another key insight is that feedback is most effective when it's delivered immediately after a skill is performed.
Got it.
So this allows the learner to make adjustments in real time.
Right.
And really solidifies their understanding.
So right then and there.
Right then and there.
Yeah.
Yeah.
Okay, so immediate feedback.
Immediate feedback.
Clear instructions.
Clear instructions.
No medical jargon.
No medical jargon.
Okay. Are there certain feedback devices that are...
So there are a variety of options available.
Okay.
Ranging from basic metronomes that help with compression rate to more sophisticated devices that give feedback on multiple aspects of CPR performance.
So it just depends on...
It depends on the learner's experience.
Okay.
Training environment, the available resources.
So find the right tool for the job.
Exactly.
Okay. What about beyond devices?
So beyond devices, debriefing is becoming really important.
Oh, tell me about that.
So this is a structured conversation after a training scenario where the instructor and the learners can reflect on what went well, what could be improved.
Got it.
And how to apply those lessons to future situations.
So it's like a post-game.
It's like a post-game analysis.
Yeah.
Exactly.
Yeah. I like that.
It provides a safe space for learners to ask questions, share their perspectives, and really internalize those lessons learned.
Yeah, it's not about pointing out mistakes, it's about learning.
Exactly.
Yeah. Are there guidelines for how to conduct these debriefings?
So the ILCOR guidelines highlight the value of debriefing scripts for instructors. And these scripts can help ensure that the feedback is consistent.
Got it.
Regardless of the instructor's experience level.
Okay, so it's like a roadmap for the instructor.
It's a roadmap.
Yeah.
And they help keep the debriefing focused and constructive.
So it helps to standardize it no matter.
Yeah, it promotes a more standardized approach, which is really crucial for maintaining quality and consistency across various programs.
But there are some caveats to using these scripts, right?
But there are. So while they offer a valuable framework, it's important to remember that they're just a tool. Effective debriefings should be tailored to the specific learners and to the specific scenario.
Got it.
And they should encourage active participation and reflection.
So you're using the script as a guide.
As a guide, but allowing for that flexibility to create an engaging learning experience.
Yeah. Okay, so we've talked about the importance of feedback, different devices, debriefing.
Debriefing.
What does all of this tell us about BLS training?
So BLS is a dynamic field that's constantly adapting and improving.
Right, because they're always doing research.
Exactly. We're always incorporating new technologies and research findings to enhance our training methods.
To make it better.
To make it better and ultimately to save more lives.
That's the goal.
That's the goal.
Awesome. Well, I'm excited to see what the future holds.
Yeah.
For BLS.
Yeah, it's inspiring to see all of the research and innovation going on in BLS.
Totally. Okay, so we've talked about all this cool technology.
Yeah.
But let's talk about education.
Okay.
Because that's really the foundation of effective BLS.
Education is key.
So what do these updated guidelines have to say about education?
So they have a lot of great insights into how we can optimize these learning experiences.
Okay.
And one of the main focuses is tailoring training to specific populations.
Okay.
Because different groups have different learning needs and styles.
That makes sense. So, like, what kind of populations are we talking about?
So, for example, the guidelines highlight the need for specialized courses for people with disabilities.
Okay.
So these courses might incorporate visual aids, sign language interpreters, and they might adjust the course length to accommodate individual needs.
That's fantastic, because everyone deserves to know this.
Absolutely.
But it's not just about accessibility. It's about making it engaging and fun to learn.
Exactly. So the guidelines actually recommend incorporating something called gamified learning.
Oh, gamified learning. Okay, so turning it into a game.
In a way, yes.
Okay.
So it's about integrating game-like elements, like challenges and rewards and interactive scenarios.
So that it's more fun to learn.
To make it more engaging and fun.
Okay. And is there research?
There is that backs this up.
Yes. There are studies suggesting that this approach can improve both knowledge retention and skill performance.
It actually works.
It actually works.
That's cool.
Yeah.
What about other innovative approaches?
So another thing that the guidelines encourage is the exploration of technology in BLS education.
Oh, okay. So like what?
So things like virtual reality simulations.
Oh, wow.
And augmented reality applications.
Really? So we're using VR and AR.
VR and AR.
To teach CPR.
Yeah.
That's amazing.
It is pretty cool.
So how does that work?
So these technologies allow learners to practice their skills in these immersive, interactive environments that closely mimic real-life scenarios.
So instead of just practicing on a mannequin, they can actually...
They can be in a virtual world.
Wow.
Responding to a simulated cardiac arrest.
That's so cool.
Yeah, it is.
I mean, that has to be so much better for like...
It's a great way to build confidence and competence.
Yeah.
And these technologies are becoming increasingly sophisticated.
Right, because they're always getting better.
Always getting better.
So anything else that we can do to elevate BLS education?
So one more crucial point is the importance of ongoing practice and reinforcement.
Okay, so it's not just a one-time thing.
It's not a one-time thing.
We just keep doing it.
You have to keep doing it because BLS skills are perishable.
They degrade over time if you don't use them.
So how do we make sure people are staying up on it?
So the guidelines recommend regular refresher courses and ongoing practice opportunities.
Got it.
And there are a lot of great resources out there.
Like what?
There are several apps and online platforms that allow people to practice their BLS skills.
Wow. So you can do it anywhere.
You can do it anywhere.
So no excuses.
No excuses.
But ultimately, this responsibility for education doesn't just fall on us, right?
Oh, it doesn't.
Like healthcare providers.
It's a shared responsibility.
That's everyone.
We need to foster a culture of preparedness where everyone feels empowered to act in an emergency.
That's fantastic, and it all starts with education.
It all starts with education.
Well, this has been a really insightful deep dive.
It has been fun.
Into the new guidelines.
Yes.
And the key takeaway, I think, is that BLS is constantly evolving.
Absolutely.
So we all have to stay up to date.
We do.
On the latest
recommendations
and really make sure that everyone in the community is equipped to act.
To save lives.
Awesome. Well, thanks for joining us for this deep dive.
Thank you for having me.
Until next time, stay safe. Keep learning.
Yes.
And remember, you have the power to save lives.